Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, drug of choice versus conditions for hypertension. So, drugs, the stage 1 hypertension. So, for stage 1 hypertension, the drugs which are preferred are thiazide diuretics are preferred. So, stage 2 hypertension, the drug preferred for stage 2 hypertension are thiazide diuretics along with either ACE inhibitors or ARBs, or we can also use calcium channel blockers. Then drug of choice in black population, if it was mentioned that drug of choice in black population, then they want to answer, then if it is given as drug of choice in black population, actually black population and white population variation is mainly done in according to JNC 8 guidelines. So according to JNC 8 guidelines, the drug of choice of hypertension in black population is mainly thiazide diuretics. If thiazides are not given in option, then you can mark calcium channel blockers. Then drug of choice in non-black population is mainly the thiazide diuretics. But if thiazide diuretics is not given in option, then angiotensin converting enzyme inhibitors, or we can also give the angiotensin receptor blockers, followed by, if this is not there, then the calcium channel blockers at the end. So this is how we give for black and non-black population. Then, if you were asked what is the drug of choice for hypertensive emergencies, drug of choice for hypertensive emergencies is IV nicardipine. For hypertensive emergencies, the drug of choice is IV nicardipine. Then drug of choice for hypertensive emergencies, but if these hypertensive emergencies are present in pregnancy, so drug of choice for hypertensive emergencies in pregnancy is labetalol. Then drug of choice for hypertensive, so okay, drug of choice in hypertension in pregnancy is also labetalol. Okay, so this in hypertensive emergency we give labetalol by intravenous route. Then drug of choice for pregnancy induced hypertension or hypertensive crisis in pregnancy is again labetalol, and here the labetalol is given intravenous route. Then drug of choice for chronic hypertension. Chronic hypertension in pregnancy, the drug of choice, it is alpha methyl dopa is given for has drug of choice for chronic hypertension in pregnancy. Then the drug of choice for hypertension with peripheral artery disease or with heart failure. If the patient has heart failure or peripheral artery disease along with hypertension, then we give ACE inhibitors more commonly than angiotensin receptor blockers. Then, what is the drug of choice for pheochromocytoma? The drug of choice for pheochromocytoma is actually phenoxybenzamine is given as the drug of choice. In pheochromocytoma, you will have to start the treatment with alpha blockers, followed by you can give beta blockers also after first giving alpha blockers. So first you give alpha blockers, that is phenoxybenzamine. After that you will give alpha plus beta blockers together. We give for pheochromocytoma. Then drug of choice for hypertension in microalbuminemia. If the patient has hypertension along with microalbuminemia, or the patient has hypertension along with chronic kidney disease, or if the patient has hypertension along with renal dysfunction, then we give angiotensin converting enzyme inhibitors more commonly than angiotensin receptor blockers. Then, drug of choice for hypertension with end stage renal disease. In patients with hypertension with end stage renal disease, we can give angiotensin converting enzyme inhibitors. Drug of choice for hypertension in with diabetes mellitus. The drug of choice for hypertension with diabetes mellitus. This is actually angiotensin converting enzyme inhibitors are given, followed by ARBs, followed by calcium channel blockers are given. Now, if you were asked what is the drug of choice for hypertension with diabetes mellitus with proteinuria, so in such case also it is better to give ACE inhibitors first, followed by ARBs. Calcium channel blockers are not indicated. Now, drug of choice for aortic aneurysm. In aortic aneurysm, the drug which is given is beta blockers are preferred in aortic aneurysm. Then drug of choice for hypertension in asymptomatic, if the patient has hypertension with asymptomatic atherosclerosis, um, if the patient has asymptomatic atherosclerosis with hypertension, then we give calcium channel blockers. One more thing, drug of choice for hypertension in aortic aneurysm is beta blockers. Then drug of choice for hypertension with supraventricular tachycardia, there is hypertension and the patient also has supraventricular tachycardia, then the drug of choice is verapamil can be given, followed by diltiazem can be given for hypertension along with supraventricular tachycardia. Then drug of choice for stable angina, drug of choice for stable angina is beta blockers. Then drug of choice for hyperaldosteronism. Drug of choice for hyperaldosteronism is spironolactone. Can be used alone or in it can be used alone or it can be used in combination with other diuretics. So drug of choice for hyperaldosteronism is spironolactone is used alone or in combination with other diuretics. Now, drug of choice for here one minute. Drug of choice for hypertension in stable angina is beta blockers. Similarly, the drug of choice for hypertension in hyperaldosteronism is spironolactone. Drug of choice for hypertension with dyslipidemia, if the patient has hyperlipidemia and also if the same patient has hypertension, then the drug of choice is angiotensin converting enzyme inhibitors, more commonly than calcium channel blockers. Then drug of choice for hypertension in previous stroke patient is angiotensin converting enzyme inhibitors, followed by angiotensin receptor blockers can be given, followed by diuretics can be given. Then drug of choice for hypertension with previous MI. Drug of choice for hypertension with previous myocardial infarction is we can give angiotensin converting enzyme inhibitors, followed by angiotensin receptor blockers, followed by beta blockers can be given. Then drug of choice for hypertension with metabolic syndrome. Hypertension with metabolic syndrome, the drug of choice is we should give ACE inhibitors, followed by ARBs can be given, followed by calcium channel blockers. Then drug of choice for hypertension with asthma. If the patient has asthma or COPD, we cannot give beta blockers, so we give calcium channel blockers, followed by diuretics can be given. Now, drug of choice for hypertension with benign prostatic hyperplasia. In benign prostatic hyperplasia with hypertension, we give mainly the alpha blockers are given. You can give tamsulosin. Now, drug of choice for isolated systolic hypertension is if the patient has only systolic hypertension, that is isolated systolic hypertension, then we can give ACE inhibitors or ARBs, followed by calcium channel blockers, followed by diuretics can be given.
Thank you and thank you for watching.